to go ahead and record this. All right. So I am really excited to be here with you today. My name is Kristin Evans. I am a dental hygienist. I have been in dentistry for over 30 years. I love dentistry. And so I just want you to know that this is super exciting for me to come in, especially here into your school, to be able to educate you guys today on some sort of alternatives. If not, really, we're hoping that GuruNanda becomes mainstream for oral care. We're really excited to do that and to bring that to everyone.
Do you know
So I
we are distributing your toothbrushes now in clinic and
I
getting
love
great.
it.
Yes.
Thank you. We are excited to hear about that. Well, I'm going to tell you a little bit more about our toothbrushes. We are definitely known for our butter on gum toothbrush, and we'll get into that. I did just have a brief conversation with your clinical instructor, and we talked about the fact that we're going to talk about oil pulling today and also other products that you guys can bring into your really basically allowing your patients to get. I will teach you, kind of educate you on where they can get those. And then once you guys get into clinical practice, you guys can bring those into your office. We can educate. I can come in and educate your office and let them know that this can be brought in and used as a tool that you can hand out to patients in your dental office also. But for now, for you guys, it'll probably be recommending to, I know you guys have some of our butter and gum toothbrushes in your clinic. We'd love to help you guys still and support you in that. But also, you guys can let your patients know that many of these products are available in our retail stores, and we'll talk about that. I just want you to know also, I'm an oral systemic national speaker, and I love dentistry. And I love making sure that we don't fit our patients into just one box that try to put everyone in, because many times those patients start to feel uncomfortable sometimes in that box, and they really need something different. And today I'm going to show you how we can customize that for each patient so that they feel comfortable in the products that they are using. So I'm excited about that today. So I'm going to make sure, did my screen advance for you guys?
Yes.
All right. I love it. That's what I wanted. All right. So I want to tell you guys a little bit about GuruNanda, the company. So this company is all about really natural ingredients, and not just natural ingredients. We want to make sure that these are high quality. And when you sometimes get high quality, sometimes there's a price point on that. But our CEO, who is Dr. Fresh, we're going to meet him in just a second. I'll show you him, give you a little background, but he wants affordable oral health care for everyone. His aim is that everybody can get access to affordable oral health care. And I'm going to show you today how we can do that. We also are made in the USA, by the way. If you guys are in California, we are excited that we also will be at CDA. So please, if you guys are attending the California Dental Association conference here in a couple of weeks, we would love you to come to our booth and to come and see us. But we are located, the company is located in Buena Park, California. So we're made in the USA. This is rooted in Ayurvedic practice. So we are going to talk about that in just a second, because we're really taking Western culture, the Eastern, traditional Eastern that's been around for for a long time, for centuries, and we're going to bring that into the Western culture. So I want you to know that our CEO says he puts boots on the ground at every farm that he gets his essential oils from. He makes sure that he goes and he's very active in that, going to the country of origin to find these oils. This is Dr. Fresh. I just want to introduce you. Many of you that may be on social media may have seen him. He is a very active part of this company. He cares a lot about this company and oral care. His family is rooted in their Indian background, which they manufactured also toothbrushes from these companies that you see here that many of you recognize. He also invented the Firefly toothbrush in the year 2000. This was to help children brush longer. And it was a great thing. He's been awarded the Ernest and Young Entrepreneur Award. He earned it last year in 2025 and also in 2011. And we're really proud of him. He's always advancing, trying to find things that can help and support patients and their oral care. So I want you to know that you guys can easily go on our retail site. Once you get into your dental clinics and start practicing, you guys can actually go on our professional site. Our professional site has more like cases that like you get at your clinic in your school. But we also try to provide that for our professionals at a very good cost for them to pass on to their patients. But if you need to buy something or your patients do, we are available on retail. One of our largest retails is Walmart. And so almost everything we have is available at Walmart, but it's also available on GuruNanda.com. And you'll see it sporadically at other places, including even the dollar store. But I want you to know that we have other products besides oral care. We also have wellness products that actually fit into dentistry as we look at mouth taping. We have MCT oil, which I'm going to talk about in a few minutes. We also have things that help with nasal irrigation. And we have vitamin D, E, and K2 black seed oil, which does strengthen epithelial in the mouth. So these are things that are going to help and support our patients. So I encourage you guys to get on our retail site, to look at it, and to be able to see what there is to offer, that we have to offer. I'm excited to show you some of that today. So I want to talk to you about Ayurvedic practice. So Ayurvedic, it's actually a concept that's been around in India for centuries. So the Ayurvedic practice is, their concept is that what we bring into our mouth ends up in our whole body. And as an oral systemic speaker, that is I'm very passionate about that, because what we do bring in our mouth is important, and we need to educate our patients about that. Well, one of the things about following Ayurvedic practice is first thing in the morning on an empty stomach, they want to make sure that when they wake up, before they eat, drink, and swallow even, the pathogens that have accumulated in the night because of the dry mouth that we many times have, because of our lower saliva flow, because of the toxins we breathe in, and many people more as their mouth breathing, we want to make sure that those pathogens don't come into our body. And so the Ayurvedic practice is oil pulling. And oil pulling is where they use, usually the traditional way is to use coconut, sesame, or sunflower oils. These are oils that they also use in cooking, and they put them in their mouth and they have to swish. It shows 20 to 30 minutes before those oils start to thicken, kind of emulsify and bind and hold. But our oil is the number one oil pulling, and we are excited to tell you that our oil is fractionated. Fractionated oil means it's at a liquid state, and it's all the time in that state. So it actually, within 2 to 5 minutes, which we have research showing, within 2 to 5 minutes, that oil can start to do the benefits of binding and holding and really taking those pathogens hopefully out of the body, because after you swish for 20 to 30 minutes with regular oil, or with our oil just 2 to 5 minutes as a pre-brush rinse first thing in the morning on an empty stomach, you then spit it in the trash, because we don't want to swallow or have that in our body. And then you brush, you floss, you tongue scrape. And we're going to go through those in just a second. But this has been around in Ayurvedic practice for a long time. And again, we are trying to bring this in the Indian culture of Ayurvedic practice that's been in for centuries in the Western healing. We want to bring that, or excuse me, Eastern healing. We want to bring that into the Western culture. So I will tell you the mechanism of action is, many times I use this concept for people, is about your car and oil. Most of you may have a car, you have to maintain and go change the oil, because oil really does two things. Oil cleans it. If it didn't clean, then the oils wouldn't get dirty in our car. But of course, we do know that oil does bind and grab particles and holds things. So oil does create that. Now in the mouth, we're going to talk about this first, is the cleaning. The concept of oil pulling is that we want to swish it around in the mouth. The lipid, 100% lipid, which is oils, will trap and hold those impurities. As it combines also with saliva, it creates what's called saponification. That is creating almost like a soapy-like substance that naturally then provides a clean and bright, fresh surface. We also, some people will say there's like a whitening appearance because oil does refract light. So many people say they feel like their teeth are more slick and they are a little shiny. That's just comments we get from people that, many people comment on different things with our oils and everyone is a little different. So we are excited about that oil and the action of it. Now, what makes our oils also different than just using a normal cooking oil like they would traditionally is that our oils also, our pulling oil, this one particularly, has other essential oils that have been used in dentistry for decades. So each of these oils specifically have been used in dental products to support. They support healthy mouth. They also, all of our oils are pH balanced, and I'm the pH RDH. Love you to follow me on Instagram because this is important because our products need to be pH neutralizing and balancing. And I am so grateful for GuruNanda's pH balancing formulas. We also don't have any alcohol, so it will help in our second thing, what we talk about, which is the hydrating or moisturizing. We have no artificial colors, fragrances, or GMOs. There is no SLS, which is sodium lauryl sulfate. That is important in products because that is a detergent agent that sometimes may cause tissue sores, may cause aphthous ulcers or canker sores in patients, and it can cause some hypersensitivity in some individuals. So we want to make sure that that SLS, we do not have any of that foaming agent in our product. I will tell you, I would love you, invite you to go on our gurunanda.com website. I would love you to go on and look at some of our scientific studies. These scientific studies show that we can also help microbial loads, like strep mutans. We also it helped many of our oil, our coconut oil specifically is anti-inflammatory. It also has abilities to fight against some gram-negative and positive bacteria. And we also show that the 2 to 5 minutes is beneficial, that it still binds and holds in a shorter time frame than 20 to 30. 20 to 30 minutes can be a long time for someone to swish into their mouth in order to get that. But it really needs to do that if they're using just traditional oil and not our fractionated GuruNanda pulling oil. So our oils are also found, you can get them in many shapes and also different flavors. We do have a children's one that's not listed on here. For anyone that doesn't like cinnamon or peppermint, you can get the children's oil. It is actually just like a fruity taste. It like a berry, and it is really pleasant. I actually really like it. But we also have the cinnamon, ashwagandha, and neem, and that we have specific people that are using that with salivary testing on certain bacteria that has been showing great help with that. So there are some things, there's some new people that are starting to dive into our oils to see if they can help. Again, personalizing care for people to see if they can do something in a very natural way. We have different sizes also in our oils. When you buy them retail, they're usually in the 8-ounce, but we do have little 3-ounces for offices to give out, or the little sachets, which you guys got today, I think, in your oral care kit that we sent, if you guys have got your samples.
I already distributed it. So
yay! All right. I love it. So you guys got the little sample of the oil in that, and then you probably got the little 3-ouncers too that we sent. So I'm excited for you guys to try those oils. Now, I will tell you also that the other quality that oil has is it is a lubricant. We know that we add oil sometimes to different engine parts or different machines or different things that have to move and have a little bit of lubrication. So guess what? Oils do lubricate. Now, you can use these oils also for people who maybe just are sensitive to maybe other essential oils or have an allergy. These are oils this one is particularly the MCT oil that I talked about. It is just 100% single ingredient. It's fractionated coconut oil, so it's MCT oil. It's a high grade oil, coconut oil that is beautiful for people to use because it's very, very mild. I actually recommend this for my chemotherapy patients or for people that are struggling with dry mouth issues because this can help some people. And so I like them to try it to see, could this oil actually help you if you need to use it periodically throughout the day. Now, if we're using it to pull for 2 to 5 minutes, that's the cleaning action. So that's to be done first thing in the morning. But if you have somebody that needs to use it more often, we recommend these oils, which are more, do not have all the essential oils. They are just either coconut oil and peppermint, or sesame seed and peppermint oil. And I recommend they just put a small amount and kind of rub it around, and then they can spit into a napkin or something. We don't recommend a lot of swallowing of oils, but it is safe and for naturally safe for them. But they just need to put a little bit in. I say it's kind of like using chapstick, but for their mouth. So it's just quickly, and many of you may know that dry mouth, or people that are struggling with moisture, not enough moisture in their mouth, sometimes having a little something different, and they have to do it periodically throughout the day, this could be very great for them. And it comes in the 8 ounces, which is a lot. And they can, again, get this at our retail stores or on GuruNanda.com. So I want to go into some of our oral care products now that you may see. We do have a water flosser, by the way. We love our water flosser. So please get on and look at that, because it provides really great access for people with implants. We want, as a hygienist, I recommend people using it with implants. I recommend it, a lot of people using a water flosser. I love the ones that can be taken in the shower, and ours can be taken in the shower because it is waterproof. And so you guys are really, this is a great tool for people. I think we get our most acceptance or usage compliance if they can use it in the shower. So just to let you know, they are available and they can see that. Get those there. We do have our toothpaste. I am very excited to tell you that we do have a new toothpaste. Our original toothpaste has micro hydroxyapatite. And so it's right here. It's our first one. We have a new one that has actually nano hydroxyapatite that we're super excited about. This is a sensitive toothpaste. I love this toothpaste. I love the consistency. I love both of them, but I love this one in particular because I do have some sensitivity, and I found it works really well. There's some great things that are in here. For one thing, potassium nitrate is very important for filling the dental tubules, and that is in this product. We also have L-arginine, which can help with saliva, activate saliva. And it also, L-arginine, there's some new things that are kind of you may hear out there about L-arginine if you guys want to dive deeper and research into that. But it is showing that it can possibly help with nitric oxide. And so I'm excited about this product. It has xylitol in it. Xylitol is a stimulator of saliva also. And so between all of those, the nano and the potassium nitrate would help, which really help with sensitivity, remineralizing. We also have the other things with L-arginine and xylitol that can help. So I'm excited about this toothpaste. It's at a very great price point for your patients to get for a hydroxyapatite toothpaste. We also have our kids one, by the way, guys. If you don't have someone that is sensitive to peppermint or any kind of mint, we do have the kids, and I'm telling you, it is yummy. It is strawberry and mango. This one has 25% xylitol. And xylitol, again, is great for impeding causing bacteria. And it also stimulates saliva. There's also hydroxyapatite in our toothpaste also. So for the kiddos, it is a micro. So we're excited about our toothpaste. By the way, the kids' toothpaste has no dyes or artificial flavors at all. So we're excited about that one. I will tell you a little bit about our tongue scraping. I told you before, our oils are a pre-brush rinse. And so we really recommend that after that, we do tongue scraping. I recommend every time my patient brushes that they also tongue scrape. Tongue scraping is extremely important, and only 20% of our patients statistically are actually doing it. And so we as dental professionals need to make sure that we're talking to them about that. We have an amazing tongue scraper that is stainless steel. What I love about that with the medical grade stainless steel is that your patients can actually purchase this and put it in the dishwasher, but you can also have it in clinic. You can put it in an autoclave so that you can then show chair side, put it in a bag, autoclave it for your next patient. So I would suggest that you have one of these so that you can show people what is on their tongue, especially when they get candida or the white overgrowth that many times will happen. You can show them how to remove that. Now, you guys, I know you said you love our toothbrushes and hand them out. Thank you so much. I will tell you a little background between of this toothbrush. Dr. Fresh actually developed this toothbrush for a friend who was undergoing chemotherapy. And he came to him and said, I can't find a toothbrush that doesn't hurt. And Dr. Fresh was so amazing. And he said, I will find you a toothbrush. I will make it for you. And he made the butter and gum toothbrush. This toothbrush has 8,000 bristles. And I will tell you, the bristles do stand up. Some people will say they're so soft, it's probably going to just wear out too fast. I will tell you, this toothbrush has integrity. I love this toothbrush, and we are known for it. It is our ADA accepted toothbrush, and we're excited about that. And so it's a great price point. Your patients can also purchase these, by the way, at the retail stores or on our website also. And then our junior brush, this is the only toothbrush my grandbabies use. The reason is I have it be the first toothbrush they ever use is because sometimes the first toothbrush a child uses can become almost a weapon. It hurts. Their gums are so inflamed and sore that putting a toothbrush on them can feel almost like sandpaper to them. So we need to make sure that we put a very soft toothbrush, and our toothbrush is amazingly soft. This toothbrush also has a little grippy, it's kind of a soft grip handle. The patient then has a little bit more of ability. I also use this for my geriatric, my elderly patients that may be struggling and need a larger handle and a smaller head. So we love that it's also BPA free and latex free. So these are, again, toothbrushes to recommend. Now, if you guys haven't seen our ready to go brushes are amazing. These can be found on Amazon too, and on our web, or excuse me, they can be found at Walmart. These are also found on our website. They are pre-pasted with fluoride-free toothpaste. This toothpaste is pretty much xylitol. We did that with non-fluoride. None of our products have fluoride in them that I'm going to talk about today. So everything we talk about is a fluoride-free option. And xylitol does, again, stimulate saliva. And if our saliva has natural HA, hydroxyapatite, in it, it has the calcium and the phosphate for remineralization. But we also wanted this fluoride-free because you can swallow this when you're out and about. Let's say you're on an airplane and you need to use it, or you're at school. And you can't have access to a sink. And this is perfect. We can do this. And so these are, again, very small. They're lightweight, they're single, and you can get those. They're 100% recycled plastic. And again, cruelty-free, BPA-free. We are excited about these. We also have our expandable floss. Expandable floss is really great for hygiene and for dental procedures, especially if you're using it for like Curodont or silver diamine fluoride. These non-invasive restorative procedures do require us to have sometimes a floss that has a little bit of expandability to it to hold the product. And so our floss expands only where you need it to, or where it contacts the tooth, and then it expands. And so it can get interproximal. If any of you have seen like a brand that's the Superfloss brand, those have the Superflosses the whole way through it. However, ours you can only expand a little bit if you were to use it for like silver diamine fluoride interproximally. And so we are excited about this floss. It comes in 10 yards. Most flosses that are given out to patients are around 4 yards. We are excited. Ours is 10. We have no forever chemicals, no BPAs or PFAs, and ours is non-allergen. And it is available also in non-flavored, vanilla, mint, or cinnamon. Now, if you wanted or your patients wanted more than just 10 yards, we do have available 55 yards, and that is available at a very affordable price on our website. Just go on and look at the retail, or you can sometimes get it at the retail stores. So we're excited about the floss. People love our floss. We also have a signature mouthwash. This concentrated mouthwash is in a small glass bottle. It's really for people that want to still have the blend of our 7 essential oils, and you combine it with water, but they don't want to maybe have as many of the plastics being more eco-friendly. There's 300 uses within this, and it's just great for antibacterial and antifungal. Anything with tea tree has also some antifungal to it, and that can help also with the yeast, as we talked about earlier. So this is a great way for breath freshening, and again, this is fluoride free. So we are moving into our mouthwashes now, and I will tell you that I love this mouthwash. Many times people say, well, it's whitening, or maybe it's going to cause some hypersensitivity or something like that, but this does not usually cause any hypersensitivity. But what I love about this mouthwash is it's pH balancing, and pH balancing is important for our patients that, especially if they're struggling with maybe even low saliva flow where their body isn't naturally neutralizing pH. We also have hydrogen peroxide. And really, if you guys are studying, if you want to dive deeper into hydrogen peroxide in a low dose, it is starting to catch a lot of fire in dentistry right now as we're turning kind of back to the original use of what hydrogen peroxide was originally going to be used for, which was helping to control pathogens by creating the oxygen. And so hydrogen peroxide can actually be very beneficial, not just for whitening, but it could benefit our patients for maybe even caries or perio prevention. Again, it's individualized. Could something very simple as our wonderful natural mouth rinse help our patients. You guys also got our breath harmonizer. This is our other ADA accepted product. This is ADA accepted for 12 hours worth of fresh breath freshening. By the way, this has the sodium chloride. Sodium chloride does help with the sulfurs, and so that does help with helping with halitosis. This is also pH balancing again, no alcohol, no fluoride. We are very excited about this. This is probably our #1 rinse. And if you guys come to CDA, we should be able to sample some of our other mouth rinses too that you may not have gotten today. This is my favorite, really my favorite mouthwash that we just came out with. We actually developed it we had some cancer institutes coming to us saying like, hey, we really would love to use your product. But many times people that are undergoing chemotherapy, they can't really have anything that may cause irritation. So we made this, and I love that it is a beautiful pink bottle. And this actually has no flavor agent. It has no alcohol. This is a beautiful, basically like a salty water rinse. This can be used as pre or post surgery, also in your dental clinic. Our mouth rinses come in like 33 or 32 ounces with a pump. So you guys can get these and put them in your clinical operatory. You can utilize them before or after your appointments to make sure that patient has that ability to freshen and clean and feel really, really just gentle. And they can purchase that. They can purchase it online or also at Walmart has that. So we have, and by the way, Walmart, when I say that, sometimes they have them in stock, sometimes they don't. You can always find it on our website too. This is the kit that you guys got. We're excited to have you have that because it's really our total care. It has everything in it to be able to support oral health and wellness. And so you can give those to your patients. So we also have the pod. By the way, California passed that you cannot put an individual mouth guard, retainer, any kind of night guards or partial dentures. You can't put them in a communal ultrasonic. So this has been really popular for dental clinics to be purchasing to have in operatories because you can utilize it for single patient use. It has a steel container that can be wiped out. So you can wipe that out and have it ready to go for the next patient. They can also purchase these, again, on our website or retail. And they're great for cleaning any kind of partial dentures or retainers, things like that. We're really excited. It's got a 5, 8, and 10-minute timer. We've had a lot of people really loving this product. We're excited to bring it. And then the last thing we're going to talk about with, oh, wait, first, I forgot, we have our retainer cleaners that go along with this. Anybody that's doing Invisalign or has retainers, this is a hydrogen peroxide based, so it has no harmful chemicals. Spray it on, wait for about 5 minutes, and then you're going to rinse it off. And it helps with malodors and cleaning. So this is a great product people are excited about also, with so many people using Invisalign or tray aligners. We also, the white strips are fabulous. And you guys, I'm excited for you guys to try these. Everyone that I talk to that uses these say they really stick on. And I say, yes, they do. They really stick on. I love that they stick on. This again is a low grade hydrogen peroxide, which again, we talked about that can help patients with whitening and possibly other things that could help with just their oral care. But these are fabulous white strips. They come in 14 strips, 7 uppers, 7 lowers. So you can get the full week if you would like, or you can space it out. Within 3 to 5 days, you'll have visible results. These do have coconut oil in them, and coconut oil seems to be a little bit less sensitive to people. So people have often commented that they don't have as much sensitivity. These are found over the counter. Dental offices can purchase them, but your patients can also purchase them at a really good price point on our retail site or on our website. We wanted to let you know that we also have we purchase Natural Dentist. Natural Dentist, I love this product because it actually has 20% purified aloe vera. Aloe vera is actually, if you research again into that, that has shown in some clinical studies that people can really help them with their epithelial, with healing, and maybe even with some perio. We know that aloe vera has been used for a long time for wound healing. And so we love that we are keeping this product, another, again, alternative non-fluoride that the patient can use if they want to use this. And by the way, Natural Dentist is Stimudents. If you were a dental professional like me of 30 plus years in practice, you would know that there's a huge following for Stimudents. And we are excited that Stimudents is not going away, that GuruNanda has continued to, they're going to continue to bring Stimudents to the dental community and to our patients to be able to use. And these are the triangular wooden, they stimulate the gums, supporting gum health. So we're excited about that. So I want to let you guys know that we are so thrilled that you were with us today. Does anybody have any questions, by the way? First off, Joanne, the Guru 15, I will send that to you in an email.
Okay.
Because that one will allow your clinic to purchase at a 15% discount. So that is our gift to you for having me here today. So, hey, does anybody have any questions? I would love to support any questions today that you guys have.
Any questions, anyone? They're quiet today.
I will just tell you, I give a lot of really good information. It's just a wonderful products line to use because we really try to make it affordable, but with beautiful natural elements to it, ingredients that support our patients' health. And we are really excited about that. Does anybody have anything? Has anybody, since you don't have any questions, which is great, would anybody like to tell me a little bit about maybe a product that they've used before that they liked or why they liked it?
How many of you have used this prior or heard about this prior to us? Looks pretty new to everyone. We've got one. And
Yay.
it, right? The oil pulling. Yeah.
Awesome. Great. And of
I
course,
I have the water pick in my shower.
I
And
love it.
have
So
the little aromatherapy thing too that you have.
Oh, the aromatherapies
Yeah.
their oils are beautiful for aromatherapy. I love that. So you guys again can get on our retail site and be able to access that. I will tell you that, Joanne, do you find that the compliance, being able to use that in the shower, seems to be better than using maybe something traditionally that was found on the counter.
Oh, far better, far better.
Far
Plus the
better.
water's warm because you just use
Mhm.
the shower water and
Mhm.
it's not messy
Yeah.
because it just goes, and I get an extra few minutes in my shower.
That makes the bonus, right?
Yeah.
Yes. So you guys, compliance for our patients, really, I will tell you, getting that water in there. Again, water is oxygenated, and so that does help most of our pathogenic bacteria. They do not like oxygen. So if we can get in there and for debridement, also to get, interproximal and to break up that plaque biofilm, but also to stimulate getting that oxygen into that is just so much more beneficial to our patients, but less messy when you can do it in the shower. So great. Would you guys be also excited to use those ready to go brushes? Did you think about those in your, like, that you could have them even as you're in school, be able to use those?
Yeah, those look really great. Online, I saw that there were two styles to it though. One was with the
Yeah, we have a
pencil.
new, yep,
Yeah,
we have a newer one, the 2.0. That is our newest one. In fact, I have not personally tried that yet. I've seen pictures of it, but I have not been able to get that yet. And I am excited about that one. Yeah.
yeah, because it looks like
We're
it's separable with the, you can separate the floss pick from it. And
absolutely. Yep, you can separate it. Yeah, we are really excited about utilizing that and having that. So, well,
okay,
I'm so glad you guys got to be with me today. And so I will reach out with an email if you guys have any questions. Joanne has my email also. I'm more than willing to answer any questions that you have about the product. And I'm excited that you guys let me in today to educate you. So I
well,
hope to see you guys at CDA.
yes, thank you very much.
You're
Thank you.
welcome. See you guys.
Bye.